So welcome dear student. Now we are going to discuss micturition, reflex and cystometrography. This will cover your competency PY 7.6 as well as 1.9. So what is micturition? Everyone knows that micturition is the process of emptying of the urinary bladder whenever it is filled. This is simply micturition. The process of emptying of the bladder whenever it is filled is called as micturition, and the reflex which is concerning this is called as micturition reflex. So first let me discuss something about the physiological anatomy of the urinary bladder. So as we know, urinary bladder is made up of smooth muscle and it is a hollow vesicle, and fibers are arranged in the spiral manner, then longitudinal muscle and then circular muscle, which is also called as detrusor muscle. And this bladder, we can say it has a body. The main body is what? Detrusor muscle itself. And the trigone is the triangular area through which the ureter and urethra both pass. Okay, this is called as, this triangular area is called as trigone, and also it has internal sphincter which maintain the tonic closure of the urethral opening. Number one. Number two, it also prevent the retrograde ejaculation of the sperm. So it prevent reflex of the semen into the bladder during ejaculation. So there should not be any retrograde ejaculation. For that, internal sphincter play a major role. So this is the basic of anatomical detail of the urinary bladder. Now it also have external sphincter. External sphincter is having voluntarily skeletal muscle. Till now we were discussing about the smooth muscle, but this external sphincter have voluntarily skeletal muscle and it remain tonically contracted. It always remain contracted. Why? To prevent the dribbling of the urine. Normally there is no dribbling of the urine. So who is preventing this? It is the external sphincter, which is actually a voluntarily skeletal muscle. Okay, it can be relaxed voluntarily at the time of micturition. When you see that there is a proper place and you want to do this process of micturition, then you can voluntarily relax this external sphincter because it is made up of voluntarily skeletal muscle. Now if someone asks you what is the physiological capacity, so it depends on the age. For example, during birth it is only 20 to 50 ml. At the age of 1 year it becomes 200 ml, then adult 600 ml. But if you ask the anatomical, it can carry 1 liter, but it never carry 1 liter. It is only anatomical. Physiological, adult have usually 600 ml of urine in it. This is the physiological capacity of the bladder. Now one thing more, when urine is stored in the bladder, it remain unchanged. It does not change. So the chemical composition of the urine which is in the bladder remain unchanged because the luminal surface of the transitional epithelium, that is urothelium, form a complete barrier to pass the water, the solute and anything cannot pass. So whatever is the composition in the kidney, in the ureter will remain same in the bladder. It does not change after the storage because there is a barrier. Okay, this is about the physiological detail of your bladder. Now nerve supply. So 3 nerve you have to remember for this. One is sympathetic nerve. This is by hypogastric nerve and the root value is L1, L2. Okay, it supply the bladder, the detrusor muscle, it supply the trigone and internal sphincter. Now during sympathetic, you don't have to do micturition. You are in stress, you want to run, you don't have time, so you don't want to do micturition. So sympathetic supply will cause relaxation of the body, relaxation of the detrusor muscle, so that it should not empty the bladder. On the other hand, the trigone and internal sphincter will remain contracted. Are you getting my point? So during sympathetic stimulation, you don't have time actually. It can be done when you are relaxed, when there is a proper timing. Okay, so during sympathetic stimulation, your bladder is relaxed, and on the other hand, internal sphincter and the trigone, they are contracted. Is this clear? Now parasympathetic stimulation and the sensory both are from the same root value, and that is S2, S3, S4, called as pelvic nerve or nervi erigentis. You must have read in your anatomy also, S2, S3 and S4. And when you relax, it is parasympathetic. Now you want to do the process of micturition. So emptying of bladder will be there. So how it can happen? It can take place by the contraction. If it is parasympathetically stimulated, it can cause contraction of the body or the detrusor muscle so that urine can pass from the bladder, and it will relax the trigone and internal sphincter. So this is about the parasympathetic stimulation. Then the third is somatic. Okay, that is pudendal nerve. Again, the root value is S2, S3 and S4. It supplies the prostatic part of the external sphincter, and it is under the control of higher center. Okay, it can be reflexively and voluntarily relaxed during the process of micturition. This is by pudendal nerve. And sensory, I have told you, it is the same nerve as parasympathetic, same root value as parasympathetic, that is S2, S3 and S4, and the name is pelvic nerve. And this will sense, this is the sensory, this is the afferent. So this will sense the degree of distension of the bladder. It will sense the stretch of the urinary bladder when there is urine. When urine is collected in the bladder, that will be sensed by this sensory nerve called as pelvic nerve. And also, it can sense pain, but by sympathetic nerve. Okay, so sensory can be for distension also and can be for pain sensitivity as well. Now coming to the micturition reflex. The reflex control of micturition is called as simply micturition reflex. Very simple to understand. See, when bladder keep on filling, it will be sensed by the sensory nerve S2, S3, S4 pelvic nerve. Then it will supply the efferent parasympathetic S2, S3 and S4. That will cause contraction of the detrusor muscle, relaxation of the trigone and internal sphincter, and you can micturate. This is simply micturition reflex. Yes or no? Yes. So that is why the reflex control of micturition is called as micturition reflex, but there must be enough amount of urine in the bladder. Only then it can be intense so that micturition can happen. You do not go to washroom every time whenever you feel like having micturition. So it is controlled by your higher center. So this reflex keep on coming again and again, but it depends on your own effort that you are facilitating it or you are inhibiting it. So what is micturition? So whenever there is stretch in the bladder, it will be sensed by the sensory nerve S2, S3, S4 pelvic nerve. Then again parasympathetic S2, S3, S4 will cause contraction of the detrusor, relaxation of the sphincter so that urine can come outside. Is this point clear? Now I have told you that it can be facilitated, it can be inhibited by the higher center. So the main center of facilitation is in the pontine and also in the posterior hypothalamus. If you study your neurophysiology, you will see the posterior hypothalamus sense the cold, and that's why you start shivering. So have you felt that during cold time you have increased frequency become more for micturition? Yes, because pontine and posterior hypothalamus, these two P are facilitatory to this reflex. On the other hand, midbrain is inhibitory to this reflex. Okay, so from the cortex center as well as from the midbrain, it can inhibit the micturition reflex. Is this clear? So pons is very important. Pons is facilitatory, and that is why in the cold, when posterior hypothalamus is stimulated, you feel like having, there is increased frequency of micturition. That is why doctors, if there is transaction of brain stem above the pons but lower the midbrain, what do you think? Midbrain above the pons but lower than the midbrain, so midbrain control is lost, so no one is to inhibit, so the threshold for micturition reflex will decrease, frequency will increase, there will be frequent micturition because threshold become less, it is less inhibited by midbrain. That is why if transaction of brainstem is above the pons, okay, it will lower the threshold of micturition reflex and there will be frequent micturition. On the other hand, if it is above the midbrain, then it will remain same because midbrain is inhibitory and pons is facilitatory. So nothing will happen to that. It will remain same. So now what is the mechanism of voluntary micturition? This is the reflex. But when you think only, then you can go to the washroom, and when you have prepared time and place, and then only you will perform this act of micturition. So afferent pathway is what? As we know, when there is a filling of urinary bladder, there will be increase in the intravesicular pressure. It will stimulate the stretch on the bladder, and it will be carried by which sensory nerve? Of course, pelvic nerve, S2, S3 and S4. Then it will send the impulse sensation to the dorsal column of the brain. And where cortex, which part of the cortex is sensory? Posterior central gyrus is sensory cortex. Then there will be desire of micturition. Then according to your will, you will do this you can perform the act of micturition. So this is the mechanism of voluntary micturition. Filling of bladder, increase in the intravascular pressure, causing stretch on the bladder, carried by the pelvic nerve, then dorsal column to the brain. In the brain, posterior central gyrus sensory cortex, then you will have desire of feeling micturition. Now you will send impulse from the motor area. You want to perform the act of micturition. So you will send impulse from the motor area. It will stimulate the parasympathetic stimulation, S2, S3, S4, okay, and it will cause contraction of the detrusor muscle, the bladder, and relaxation of the trigone and internal sphincter. And also with the help of pudendal nerve, it can relax your external sphincter as well. It will cause the act of micturition. Very simple. If you try to understand, these physiology topics are very simple, but only once you have to understand. I have told you again and again that knowledge is very broad. There was a time when we don't have enough book, we don't have enough material, but now there is information overloading. Everywhere there are plenty of books. In our time, there was only one book, Guyton and Genong. Now we have at least 15 books, which we know. We have so much matter on internet. So now the time is there to limit the knowledge, to concise it. Otherwise, we cannot compete with 19 subjects of MBBS. Because to do MD, we must have command of all the subject. Okay, so we must make it more compact. Okay, more compact. Only then concept become more clear, and you can apply in integrated manner with your medicine, your gynae, your physiology, patho, pharma, or no. Is this clear? This is the afferent pathway. Now, sometimes they ask you in the viva, are there any accessory muscle also during micturition? Can you help in the micturition process? Yes. By causing relaxation of the perineal muscle, by causing contraction of the abdominal muscle, descent of the diaphragm is helping in this micturition. And sometimes breathing is also, you hold your breath with a closed glottis. So these are, you can say, accessory muscle during micturition. Okay. And after micturition is over, the last dribbling of urine in the male is by what and female is by what? In the female, actually, urethra empty by the gravity. Okay. But in the male, this emptying is by several contraction of the bulbocavernous muscle. It is bulbocavernous muscle, it is contracted, and that amount of urine is passed. This is the last dribbling of the urine droplets. Now, at what ml of filling of the bladder you will have first urge of micturition? It is 150 ml. But after having 400 ml, you will again feel like having micturition, second urge, and you will feel discomfort. You want to, do the act of micturition. So first urge start from 150 ml and second 400 ml. And if place is not appropriate, okay, then it will be inhibited. So you will try to inhibit. Suppose that you have 400 ml of, urine in the bladder, but place is not appropriate. You are attending the class, you are in a seminar, you are in some emergency situation. So place is not appropriate. Then your cerebral cortex will inhibit, okay, parasympathetic and excite sympathetic. Inhibit parasympathetic, excite sympathetic. So this will relax the detrusor muscle and contract the sphincter. So intravascular pressure will go down. Okay. So when it is relaxed, intravascular pressure will go down. Urge can be decreased. So micturition contraction will pass off the wholly or partially. Okay. When volume increases, pressure decreases, then the reflex will sometimes partial reflex will remain there, sometimes it is completely gone. But again reappear when pressure become more than 100 centimeter of water. By the practice, people used to do, no, suppose some people are engaged in suppose that you are doing surgery, continuous surgery, and it is for 5 or 6 hours, then you have to practice it. So by the practice, urinary bladder can be trained to, accumulate more and more urine. Very large amount of urine can be accumulated in the bladder. So this practice can be done. What is bashful bladder? Bashful bladder, BASHFUL, bashful bladder, sometimes they ask in the viva. Okay, doctor, tell me bashful bladder. Sometimes person is unable to, urinate in the presence of other people. Despite the conscious effort, he want to urinate, but he cannot. So we say that he has bashful bladder. Okay, this is called as bashful bladder, and it has been seen that running the tap water facilitate the micturition. Sometimes those people are who, if you read in surgery, those people who have BPH, benign prostate hypertrophy, they have, hesitancy, they have increased frequency of urination. So we say that just run the tap water, it will help in micturition process. It has been seen. So this is the physiology of micturition and the reflex. Some clinical detail. There is a thing called as deafferation, when sensation which is going from the bladder is lost. And the best example for this is tabes dorsalis in the syphilis. In the syphilis, there is lesion of dorsal nerve. So if sensation cannot go from the bladder, now patient is unaware of distension of the bladder. It will lead to automatic evacuation due to stress contraction of the detrusal muscle due to the stretch. It is called as automatic bladder. Initially, when bladder fill, do you remember when bladder fill, sensation goes, then it goes to your sensory cortex, then motor cortex, then you will stimulate parasympathetic, detrusal contract, isn't it, and relax. But when sensation is not carried, so how this whole process will happen? Patient is unaware of distension of the bladder. So how sensation will go, how cortex will think, and how this will happen? No. So bladder become automatic. So involuntarily automatic evacuation due to the stretch contraction of the detrusal muscle. If it keep on producing the stretch, suddenly there will be contraction of detrusal muscle, and this type of bladder is called as automatic bladder. So deafferation, example is tabes dorsalis, causes lesion of dorsal nucleus, dorsal nerve, and the bladder, which will, the byproduct of this is called as automatic bladder. Then the second condition is denervation. In denervation, both afferent and efferent are affected. Sometimes there is a tumor or there is injury to the chordae equina. So they are characterized by complete loss of voluntary micturition. You have no control. There is no afferent, there is no efferent. There is complete loss of voluntary micturition. So urinary bladder will become flaccid, distended, called as decentralized bladder or isolated bladder. It is different from automatic bladder. It is totally different from automatic bladder. One thing I would like to highlight here is that urinary bladder is elastic or plastic. What is elastic and what is plastic? Your lungs are elastic. I will discuss in lung. If you take air inside, automatically it goes outside. That is why inspiration is the active process and expiration is the passive process. But your stomach is elastic or plastic? Plastic. Because if food come inside, automatically it will not go outside. It will accommodate because the stomach is plastic. Your urinary bladder, it keep on accommodating because it is plastic. Uterus, it keep on accommodating the baby, otherwise baby will come out, or urine will go out, or stomach, food will come out. So these are plastic in nature. Plasticity means accommodation. Property of accommodation is called as plasticity. So urinary bladder is plastic. So initially, urinary bladder will respond at irregular interval to the adequate internal, this distension by the contraction of detrusal muscle. But they are not powerful. So if there is no afferent, there is no efferent, so there will be no powerful contraction. They will try to, contract the detrusal muscle, but they are not powerful. So there will be incomplete micturition. So there will be always some residual volume in that condition, even up to 300 ml urine can be there. So that is why they can have residual volume up to 300 ml. Okay. Now the third condition, if they ask you, okay doctor, tell me what is the effect of section of spinal cord? Section of spinal cord. When there is transection of spinal cord or syringomyelia or some spinal cord compression or some disseminated sclerosis, in all those conditions, initially in the acute condition, in the early stage, there will be spinal shock. All reflexes will go away. This is called as spinal shock. So in early stage, voluntarily micturition vanished completely. Bladder will become flaccid, distended, unresponsive. Retention of urine will start happening. Are you getting my point? And when it become more, dribbling of urine can start. So there will be retention with overflow or passive incontinence. So you can say it is overflow passive incontinence. But during early state, because sacrum is okay, sympathetic and everything is okay, but there is, there is no control of the voluntary system. All the control is gone. So initially, when there is transaction of spinal cord, all the voluntarily, involuntary controls are gone. There is no role of midbrain and pons and everything. It becomes working without the help of any pons and midbrain. But in the initial state, although sympathetic and parasympathetic are intact, but because of spinal shock, okay, voluntary micturition is gone, and even bladder is behaving like a flaccid, distended, unresponsive, and they will show you the overflow or passive incontinence, but in the early stage only. But in the late stage, micturition reflex will return. See, when there is spinal shock, all reflexes are gone. But slowly reflexes start coming back. So similarly, micturition reflex will return, but there is no voluntary control because it is gone. No facilitatory, no inhibition from the higher center, but it can be initiated by pinching or stroking the thighs. This is called as mass reflex. So due to mass reflex, micturition can be initiated. So patient used to learn this, that now centers are gone, so we can initiate micturition by punching or stroking the thigh. It is called as mass reflex. Now in those conditions when there is overstretching, overflow incontinence, if bladder keep on overstretching, there will be decrease in the nutrition. If there is decrease in the nutrition, it can cause cystitis. It lead to bladder shrinkage. Yes or no? And if it is happening again, see, in the early stage there is spinal shock, but after that there will be denervation hypersensitivity. It becomes spastic contracted neurogenic bladder because sympathetic and para are intact, but only because of the acute spinal shock they were not working properly. But after some time, when reflexes start returning, they will also return and they become hyper also. So they are called as spastic contracted neurogenic bladder. So in these conditions, you can get neurogenic bladder. Then in competency 7.9, sometimes they ask you cystometrography. So the process of measurement of the, the change in the volume and change in the pressure is called as cystometrogram, and this is called as cystometrography. So if you see the graph, if you plot the curve between delta P and delta V, if you say 1A, so bladder start filling. So as you can see here, as volume increases, pressure also increases. As volume of the bladder increases, so up to 150 ml, when there is appropriate amount of urine up to 150 ml, patient will have first urge of micturition. But after that, because of the Laplace law, what is Laplace law? P is equal to 2T by R. If tension is increasing and radius is also increasing, pressure remain constant. So in 1B, because of the Laplace law, due to plasticity of the bladder, you can note here that even though volume of bladder is increasing, pressure is not increasing due to Laplace law. That is why we say bladder is plastic, not elastic. Bladder is plastic. But as volume approaches 400 ml, then there will be second urge, and that is called as 2. So 1A, in 1A you will see that bladder filling is there, increased pressure is there, and increased pressure will cause the first urge of micturition. But when you drink more water up to 400 ml, pressure maintained. Because why pressure is maintained? Because along with the tension, radius is also increasing. This is the Laplace law. P is equal to 2T by R. And the second, there will be sharp rise in the pressure after 400 ml. So 1B is showing the property of, you can say, plasticity, or you can say it is due to Laplace law.